Good afternoon. I'm Dr. Bonnie Henry, the Provincial Health Officer for British Columbia, and today, for July 17th, this is our update on COVID-19. I'd like to start by acknowledging with gratitude that we're on the traditional territories of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations, and we're grateful to be able to present from these territories today. While we had not planned to have a media briefing this afternoon, there have been a number of developments in different areas of the province over the last couple of days that I believe are important to address in person, so I can answer any questions that are brewing and that have come up and make sure that we can give some important messages for people as we head into another summer weekend. But to start with, we have 28 new cases in British Columbia today. That gives our total to 3,198 people who have COVID-19 in British Columbia. That includes 1,032 people in the Vancouver Coastal Health Region, 1,676 people in Fraser Health Region, 136 people on the Vancouver Island Health Region, 235 people now in Interior Health Region, 68 people in the Northern Health Region, and 51 people who are from outside of Canada. We have 207 active cases, of whom 18 are in hospital now, 2 of whom are in intensive care or ICU. We have no new deaths to report. Our total remains at 189 people who have died from COVID-19. And we have 2,802 people who are now fully recovered. There has been, however, one new healthcare-associated outbreak, and that is at the neonatal intensive care unit at St. Paul's Hospital in Vancouver. I will say that the maternity unit remains fully operational, and a backup, separate NICU, as we call it, our neonatal intensive care unit, has been set up at St. Paul's so that infants and families can continue to safely receive the care that they need. Contact tracing is ongoing to understand how the virus was introduced into people in the NICU, and Vancouver Coastal Health is investigating with St. Paul's and with the staff there and to ensure we have identified everybody. There are a number of families and staff who have been contacts who are now isolated, and the families involved, everybody involved is right now being monitored carefully by Vancouver Coastal Health. On the positive side, in terms of healthcare facility outbreaks, the outbreak at Maple Hill long-term care facility in the Fraser Health Region has now been declared over, so that is good news. We have 3 active outbreaks in long-term care, 1 in long-term care, as we've said, and 2 now in acute care, so that the Mission Hospital and now St. Paul's. We have a total of 401 residents and 255 staff who have been affected in our healthcare facility outbreaks. So we do have some progression as well in some of our community outbreaks and clusters that we've been following. There are now 4 cases connected with the Crazy Cherry Farm in the Interior Health Region, and public health teams continue to monitor and support the staff and the farm family in that area. One of our new cases reported today is a worker from Alberta who is a worker at the Site C work camp in the Northern Health Region. As we know, these have been areas that we have had concern about from the very beginning of this, and we have ongoing plans with industrial camps, particularly in the north, recognizing that there were essential work that needed to be done at those facilities. And BC Hydro has been following all of the protocols. The person who was identified had their exposure in a test in Alberta. They are in isolation, and public health teams are working closely on site and monitoring the situation. A very small number of contacts have also been identified and have been isolated and are being monitored. And I think it's important to recognize that this person had very limited contacts after their recent return to the camp, and immediately identified when they were notified that they had a positive test. They have had no contact with any of the communities around that area. So I think that says to us that the protocols that we have in place have worked, and that they're being followed carefully. So that is good news. Vancouver Coastal Health will also be, or has also issued an alert for potential community exposures at the Sandman Suites Hotel on Davie Street between July 7th and July 16th. And that is part of the ongoing investigation in Vancouver Coastal Health. And so, as a precaution, anyone who may have been exposed is required. We need you to monitor yourself carefully for any symptoms. Limit your contact with others over the incubation period and contact 811 immediately to arrange for testing if any symptoms develop. Also, to complicate our Friday, we're now up to 35 cases associated with the community exposure events in and around Kelowna, BC, starting around Canada Day in the following week. And this is one of the more concerning issues to us because we recognize that there have been a number of events that have happened there, and we need people to start thinking about how we can socialize safely over the coming weeks. We anticipate that there will be more cases in the coming days as people who were exposed are now starting to develop symptoms. And Interior Health is working very carefully and very closely with a number of the events where these were happening and following people. As you know, with this virus, once you have been exposed, there's nothing we can do to prevent you from developing disease. We just need to wait it out and ensure that if you do get sick, that you are not passing it on to others. And that's how we break those chains of transmission. We did have a meeting today, and I'm very thankful for this opportunity to come up with a plan with the Mayor of Kelowna, Colin Basran, and his team, with MLA Norm Letnick, Minister Dix, the CEO of Interior Health, Susan Brown, and Dr. Sylvina Mema, the MHO in the area. And we have a number of things that we're going to do to work with the communities in the central Okanagan to make sure that we can help people safely enjoy the rest of this summer. While public health teams have been extremely effective in identifying and containing transmission, these flare-ups in our communities around the province are a concern. It is not necessarily unexpected, but it is a warning to us that we need to do more to keep things in balance. This is one of the reasons that I felt it was important to speak today. Many of these new cases are people in their 20s and 30s, and transmission is directly connected to those very important social events. We know that gathering helps us feel connected and hopeful in these challenging times. And we want to be able to continue to do that. And we also are aware that while the severity of illness for those people in our 20s and 30s, or I should say in your 20s and 30s, are typically much less. And people may not recognize that they are ill or that they have mild symptoms, but they can still spread the virus to others. And your ability to spread that virus is just as high or higher as older people. And recently I had the opportunity to take over Olivia Munn's social media accounts, something that I'm not particularly adept at, but it was a great experience. I'm not typically active on social media, but I certainly understand the value of social networks. And now I am asking you to be my voice and our voice on social media. Use your influence to share a message with your friends, with your connections around the province. And that message is to make sure that we don't let COVID steal our summer, that we can socialize, and we need to socialize safely. Or as I say, we need to play safe and stay safe. Always know who you're with when you're out. Take steps to protect each other so you can spread kindness and joy and not the virus. In the same way that we don't let friends drive drunk or that we use condoms and sunscreen, this is a time where we need to put together the things that we can do to socialize safely this summer. So whether you're on a boat, at a resort, at somebody's house, if you're hosting an event, you have an obligation to keep your gatherings small. We know the maximum is 50, and that's with social distancing. But you want to keep your bubble small, and if you're having others around that are not in your close contacts, which we do when we're out in the summer, make sure that they're small numbers, but also know everyone who's attending and be able to reach them afterwards. That's one way we protect each other. We want to know if we've been exposed to somebody who may have this virus so that we don't bring it home to the people that we love. So the best way to do that is to have a designated contact keeper. When you go to a party, if you're the person organizing it, get a contact information from the people that are there. And then public health can use that, if we need to anonymously send messages to people to make sure they know if they've been in an exposure event. And that way we can find people quickly. We can break these chains of transmission and stop the spread in our communities so that we continue to enjoy each other's company safely. So whether you're at home or on vacation, young or old, we all continue to have a role to play to keep ourselves safe and keep each other safe. And as we have been opening, it doesn't mean that this is over. And we saw from the serology report that was issued this week, most of us do not have immunity right now, and we have to protect each other from another surge. This is why our layers of protection and our rules for safe social interactions are so important. It's what's going to allow us to enjoy our time together in the coming months. So whether you're from BC and you're traveling to experience British Columbia, whether you're here from Alberta or Ontario or from the US, you need to all follow our rules here to keep each other safe. And one way to do that is to make sure that we are having contact and we know the contact information of the people that we're with, even if we just met them. This weekend, if you're planning a small party or planning to go to one, please do the right thing. Socialize safely, play safe, and stay safe so that we can keep our COVID-19 low and slow and enjoy our summer. And let's also remember to be kind as we do this, to stay calm and to stay safe. Thank you very much, and I'm happy to answer questions.
Thank you, Dr. Henry. As a reminder to callers on the line, please press star 1 to enter the queue. You are limited to one question and one follow-up only. Please unmute yourselves. You will not be audible until I call your name. First question is from Vaughn Palmer, Vancouver Sun.
Good afternoon, Dr. Henry.
Challenging. So I do think it's important that we get out, that we socialize. It does, as I said, those connections are things we need, particularly young people. This is a time in your life where those social connections are so important. But we can do it, and we can do it in a way that doesn't lead to rapid increased numbers of cases. And that's what is concerning for me. So what we talked about was telling people about keeping things small, making sure we have a way to contact people. It doesn't mean that you're going to have to call somebody up and tell them that they were exposed to this virus. We do that in public health. So once we've found somebody who's a case, that's what we do as part of contact tracing. It just makes it a lot easier for us. If we know who you're with. And that's been one of the challenges that people have talked about in exposure. Do it in Coastal is still looking at exactly how the virus was introduced. Right now, there's a very small number, so less than 10 people who were in the exposed group, and they are following up with every individual. There's nobody who is very ill. Everybody's being monitored carefully, and they've taken steps to make sure that there is adequate support in a separate physical area with separate staff, so that there's no risk to neonates at St. Paul's right now.
Next question is from Hina Alam, Canadian Press.
Hi, Dr. Henry. I was wondering if you could tell me, coming back to the neonatal unit, if there are any babies who've been exposed or any doctors, and also if you said you don't really know how many people are affected right now, but are there any nurses? Do you have any more details about it?
Yes, what I can tell you is there's been families, including some of the babies who have been exposed, and there's also healthcare workers who have been exposed, but I don't have the breakdown. That will become clearer over the coming days as the investigation continues.
Do you have a follow-up, Hina?
Yes, please. Thank you. I was also wondering what happens, do you know what happens to babies who've been exposed, especially since if they're in a NICU, then they would probably have special needs. What happens to them, any effects? And it also said that the mask policy is now being introduced. Why wasn't that policy in place earlier? Thank you, Dr. Henry.
Thank you. Yeah, so what we do know is that some neonates, some infants can have more severe illness. There's not been any severe illness in infants in BC or in Canada that we're aware of, and most young children, even infants in the intensive care unit do very well with this. There's no infant in the NICU at St. Paul's right now who has severe illness or worrisome illness at all. So that's good news, but we'll obviously be watching very carefully. So mostly young children, even infants do very well with this virus, thankfully. And the other question, yes. So there was a policy that had come out around families in the neonatal intensive care not requiring a mask when they were with their baby. And the challenge, of course, becomes most of our neonatal intensive care units are in single rooms, and this one is a more of an open intensive care unit, NICU. Although the bassinets were at least 6 feet apart, there were no barriers between them. So that meant that there was potential for people who were in the NICU to be exposed. So that's why we're watching very carefully and why the NICU has been closed. But I do believe it is a very low risk scenario for others who are in the NICU with the people who were cases.
Next question is from Penny Dafflo, CTV.
Hi there. Thank you for taking my question. I guess the first question is, how many newborns have actually tested positive for COVID, and what is your concern kind of for their long-term health?
Do we mean in this particular outbreak or overall that we know about?
I meant this one, but I guess overall would be good as well if you have those figures.
I don't actually have the numbers, but I can tell you it's a small number. Certainly across Canada, that is something we've been watching very carefully around the world. And there's Dr. Deborah Money, who's one of our obstetrician gynecologists here, is leading a study across Canada looking at pregnancy and COVID and following both mums and babes through that process. And we've had a number who have delivered already, and we've had we've had a couple of infants who have tested positive, but none of them have had serious illness. There's one infant who's positive in the NICU at St. Paul's, but is not showing signs of illness.
Do you have a follow-up, Penny?
I do, yeah. We've done so many stories in the last few months, hearing from doctors of all stripes, even, pain clinics and whatnot, from people who have a reluctance to go see doctors, whether it's because they think they're too busy or people are worried about catching COVID in a medical setting. And I just wonder if you could speak to pregnant people right now, just your thoughts on anybody who might be hesitant to go to a hospital or a medical setting because of this news, what you'd like them to know.
Yeah, you know what? We have been working very hard to make sure that it is safe for everybody, and that was something we talked about early on. It is absolutely safe to go into the hospital for your pregnancy, for your delivery, for the care that you need, and we will continue to make sure particularly all of our obstetrics units around the province have been working very carefully to make sure we screen people appropriately and we keep people away. It is unfortunately one of the reasons why we limit people who are going in with mums who are giving birth, so that we don't have more people who might increase the risk in those units. This is an unfortunate event. Thankfully, nobody is seriously ill right now, and we do know that we're putting every measure in place to make sure it's safe. So it is safe for mums who are planning to deliver at St. Paul's. Women's Hospital, of course, is also back up and available as needed.
Next question is from Moira Witten, the Tyee.
Hi, good afternoon, Dr. Henry. I'm curious, when you presented on with your colleague on serology testing and the first study out yesterday, I'm curious what effect this might have on what we know when schools reopen in September. Do you foresee using serology to examine teachers and other school staff, like you mentioned you might with healthcare workers?
Yeah, it's a little bit of a challenge. Probably not. We've not had a lot of exposure in that setting. So what we want to find is, where are the higher risk settings? So we wouldn't expect that teachers would necessarily have antibodies. But it is one of the populations we'll be looking at. It will be helpful for us to know, and we probably won't be able to tell in BC, even though we had kids back at school for a month, because our rates have been so low. But in those other countries, and I'm thinking about Korea and other countries where they had children in school, to understand how much transmission happened. I know there are at least 4 studies that are being looked at under our immunity task force in Canada to try and understand the risk, the amount of the numbers and the percentage of children who have had the illness and have antibodies, because that will help us understand risk of transmission in school settings come the fall. I am a little bit afraid that we're not going to have those answers, because around the world what we're seeing is that young people really don't get it as often as older children. And why I'm talking about is children under the age of 10. Once you're over 10, your risk goes up to be more like an adult, but young children in particular seem less likely to get infected, have milder disease, and less likely to pass it on. But it is certainly one of the things we're looking at.
Do you have a follow-up, Moira?
I do, thank you. With the growing number of people considered recovered in the province, is there any, are you hearing of any people, feeling more immune, or how people are conducting themselves? And do you have any advice for the people who have recovered in the province on how to act in the coming weeks?
Yeah, that is a really important question, because we do not yet know, and our study can't answer that question. We do not yet know whether having antibodies means that you are truly immune, that you're not going to get infected again if you're exposed to the virus again. So right now, everybody, even if you have had it, we need you to take those precautions. And the reason for that is we have a pretty good idea that if you have antibodies, you are likely to at least have some protection. You might get a milder illness, for example. But we don't know how long that lasts. So as we go into the fall, if we start to see more transmission, we're all going to continue to have to take those precautions, because until we know exactly how much antibody you need to have to be protective and how long that antibody is going to last. hopefully we'll get some more of those questions. There's studies being done across the country and across the globe that is going to help us answer those questions. But right now, we don't yet know. So everybody needs to continue to use the precautions of safe physical distancing, wearing a mask if you can't maintain that distance consistently, keeping our bubbles small, making sure we're not in those enclosed spaces with poor ventilation, with lots of people and talking and dancing. Those are the highest risk environments.
Marcella Bernardo, News 1130.
Hi, Dr. Henry. Thanks for holding this special meeting today. I guess you could say we weren't expecting it, but you mentioned today that you want young people to get the message out to their friends. Don't let COVID steal our summer. Going back to the whole COVID fatigue issue, I'm noticing in restaurants people aren't giving their contact information. A lot of young people don't seem to care, thinking that they still want to have fun this summer. I guess what's your message to everyone about the need that the second wave is just around the corner if we don't do what we're supposed to do?
Yeah, I think most young people I empathize. It's been a rough couple of months, and especially if you're a young person who's going through the, what am I going to do with university, with my job? Am I going to get a job? And not being able to be around the friends that I'm connected with or I need to connect with. So, yeah, I don't want COVID to steal our summer. So that means we all need to do our bit. We can have fun, and we can do it in a way that is safe for everybody and is not going to lead to spillover. And this is what I'm most worried about. The more people that we have who are infected in social environments like this, some of them are going to be healthcare workers. Some of them are going to work in situations with people who are or live in families where there are people who are older or have health issues. That's the worry that we're going to have. And once we get into that, if we start seeing more people in hospital, more people getting sick, more outbreaks in hospitals, those are when we have to start stepping back on some of the opening up that we're doing. So as I said, open isn't over. It just means we need to take precautions and do it in a safe way. And it's only fair to the people who are working in those environments too. If we're there moving from table to table, that puts the people who are working in the restaurants at risk. And they have people that they care about at home too. So let's all do our bit. We can still have fun. We can still enjoy BC. We can still enjoy each other's company, but just do it in a way that minimizes our risk of having major outbreaks.
Do you have a follow-up, Marcella?
Actually, no, I don't.
Thank you. Next question is from Catherine Garrett, My PG Now.
My question is in regards to the Site C case. I want to know if the worker disclosed that they were awaiting test results before they traveled, and if so, then why were they allowed to?
Yeah, those are details that I'm not aware of. I don't know if that question was asked before the person traveled, and I'm not entirely sure why they were tested in Alberta. There are many reasons why people might have been tested. So I do know that as soon as the person received the information that their test was positive, they immediately reported it. And also the protocols that people coming into the environment, regardless of whether they had a test or not, are isolated and kept from having contacts with very many people. So those protocols, I think, are protective as well. Having said that, I do know that that will be a question that will be added to the questions that are asked to everybody who comes into the industrial camps going forward.
Do you have a follow-up, Catherine?
Yes, please. There are 3 new cases in Northern Health for the first time in over a month. I want to know if these are a part of an ongoing outbreak or if they tested positive elsewhere and just returned home to the health region.
Yeah, it's a combination. They're in 3 different communities, and there are different situations for each of them. I know one at least was travel-related, and the other 2, the investigation, actually 2 of them were travel-related, one from out of province, and the investigation is ongoing with Northern Health in all of them. I do know as well that they are at home and being followed, and the small numbers of contacts in each case are also being followed.
Next question is from Robin Merrill, Info News.
Talked about in the Kelowna situation a meeting with the mayor and the MLA and such to get a sort of a plan together. Can you elaborate any on what that plan is to deal with this growing number of cases?
Yeah, so this is not a problem or a situation, I shouldn't say problem. It's not a situation that's unique to Kelowna, but we know there's been a number of exposure events there, and it was an opportunity to get some messages out in the central Okanagan to people who are there for, there's many tourist-dependent communities in that area, and people seem to be using that area to come as a meeting place. So we talked about opportunities to get messages out to people who are coming to visit, whether we put them in grocery stores and liquor stores where people are picking up their supplies for parties, putting out the messages about how to do it in a way that respects the community and respects the safety of our community. And we've talked about this before, our travel manners here in BC. And making sure that people get those messages from many different sources about the things that we do to protect our communities and still have fun.
Do you have a follow-up, Rob?
Yes, I do. On the number, it's grown to, I think you said, to 35 related to this, and you say that it's going to grow more. I know you can't predict, but any projections on how much it might grow and how long it might take till we know that it's kind of contained?
Yeah, so unfortunately, it's the incubation period's 14 days. So we've had the first group of cases that we found last week, and then we found the people they were in contact with. So that's the second generation. And some of those people are now starting to get sick. And they on average, it's people start to get sick after exposure about day 5 to day 7. So we're now in the third generation of the people that they had contact with. So if we can find everybody quickly, we can stop that next generation from being exposed. So our aim is finding people as soon as possible so that they're early in their incubation period and we can support them in staying at home and staying away from others through that 14-day period. And if they do get sick, there's nobody else that's going to get sick from them. So that's how we do it. So it takes several weeks to know. I know there are several hundred people who are being followed right now, and some percentage of them will develop symptoms in the coming days and weeks. And that's why I say we know there'll be more people. How many more? It's hard to say. Some recent data has shown that that from a number of other countries, not here from BC yet, but that household contacts, so if I live in a household with somebody who tests positive, the chance of my getting sick as well is about 14-15%. If we're a community contact, it's much less than that. So somewhere between 10 and 15% of people may develop symptoms in the coming weeks.
Next question is from Zara Premji, CBC.
Hi there, Dr. Henry. Thanks so much for doing this. So regarding the exposure event at the Sandman Suites Hotel in Vancouver, can you confirm if there were any healthcare workers staying at that hotel as well?
There were a number of healthcare workers that were staying at that hotel, and that's one of the concerns that we have. I know there was a provincial program, and it was supported by the federal government early on when hotels were empty, that healthcare workers were given good rates to stay there. But now, as hotels are opening up, they are more a source of risk. So we don't want healthcare workers who are working in long-term care or in hospitals to be mixing with people who are coming in from other places. And a hotel is not a great environment for that. So that is one of the concerns that we have around Sandman, for sure.
Do you have a follow-up, Zara?
Oh, of course. So regarding the outbreak at the NICU, you mentioned the families involved are now isolating. Does that mean they can't go and visit their babies in the NICU? And I just want to confirm, you said one infant who has tested positive for COVID in the NICU. Is that from this outbreak?
Yes. The one infant is part of the outbreak, and no, that we isolate families together when they have infants. So yes, they are with their infants.
Great. Next question is from Glenn Korstrom, Business of Vancouver.
Hi, Dr. Henry. I'm just wondering about the visiting for the care homes and whether all of the plans have been approved. Are they just being rubber stamped, or have any been rejected?
Yeah, that's a good question. I don't know. I know that health authorities are working with every home to make sure that the plans are adequate. And we don't reject them generally. It would be more an iterative process to make sure they meet the requirements and that are done safely. As we've been learning through this process for everything, we'll be tweaking things as we go, and I know we're reviewing a number of the provisions around visiting to make sure that it can be done in a way that is both safe but also enables families to have as much time and as much of a contact with their loved one as possible. So as we've said from the beginning, we'll be tweaking things and hopefully being able to expand visiting as we go forward.
Do you have a follow-up, Glenn?
Yeah, just on the hiring of staff, as Minister Dix was saying, there's $165 million earmarked to hire up to 3 people for each one of these homes. I'm just wondering how the recruitment is going, and have these people been hired, or is there trouble hiring them or getting them at work?
I'm afraid I can't answer that question. Those are questions that we'll have to put to Minister Dix next week, I'm afraid. Or we can get back to you on some of that information.
We have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released later today. For recommendations on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. And for non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. Last question is from Nick Johansson.
Kelowna cluster, this 35 number, how many of these people are interior health residents, and where are the other cases? Where are they from? And have there been any hospitalizations stemming from this cluster?
Yeah, in terms of hospitalizations, none that I'm aware of at this point. They're mostly younger people, which is good, though there are a few who are older. Last I understand, and I should have written it down, but I believe it was 28 are related to interior health. Actually, that doesn't add up, because there was 18 when we had 27. There's 18 in interior health, and 9 were in Fraser Health and Vancouver Coastal. There's 1 in Island Health that's related, and the additional ones I believe are related to interior health as well. But I can get you those exact numbers. But the majority of them are people from in and around interior health. There are some related cases from other provinces, particularly Alberta, and as I mentioned, both Island Health, Vancouver Coastal, and Fraser Health.
Do you have a follow-up, Nick?
Yes, I do. With this outbreak at the Oliver Cherry facility, I understand there's currently 4 cases related to that. Are these all staff members of the facility? And Interior Health had mentioned that it was likely that this outbreak was related to the Kelowna cluster. Is that still the thought?
Yeah, as far as I know, that is still the thought. There have been extensive testing and screening done of all of the workers on the farm. And so far, 2 of the people who have tested positive are temporary foreign workers, and 2 are part of the farm family that owns and works on the property. So yes, we do still think it's linked to the Kelowna cluster, and the temporary foreign workers were, at least one of them was exposed here, not from whence they came.
That's all the time we have for today. Thank you, everyone.
Thank you.